Thank you both very much indeed. Thank you.
Thank you.
Now, over the last few months, Newsnight has been examining the many reasons which explain why the UK has such high rates of infant and child mortality as part of our series Young Lives Lost. Tonight, an investigation by this programme exposes the worry of many parents of disabled children that inappropriate housing is having a negative impact on their health. Over 40% of parents who took part in the poll of 4,000 families said their home didn't meet their child's needs. Some said they struggled to even get their children in and out of the property. 27% said they believed their home worsened their child's condition or even put them at risk. Our health correspondent Deb Cohen has this report.
Over 2 days in Cheetham Hill, Manchester, volunteers for the charity Wellchild transform this garden with new plants, decking and an accessible pathway. The work won't just make it look nicer, it will open up a new world for the 16-year-old boy who lives here, Anderson.
He's 24 hours care, he's totally dependent, to others. He can't talk, he can't work, and he needs somebody, all the time, on his side, all the time. Have to keep an eye on him,
Until 2019, Anderson was at a local school and playing basketball in his spare time. But then an accident at a go-karting track caused a head injury that changed everything.
We brought it quickly in the emergency and they found I had a quickly scan and they found out that he's having hemorrhage. Yes, and it was a very big one that, in spite that we came very earlier, but it was too late, to avoid that, brain damage.
Anderson's injuries meant he needed a wheelchair and space for lots of medical kit. The privately rented home that Batil and Anderson had previously lived in wasn't suitable, so they had to move. Anderson spent more than a year in hospital before the council found an accessible property.
It's not a lot of house, full accessibility, with full accessibility. And it wasn't easy to find the house. And here it's very, thank God for this house, at least I've got a place, with Anderson.
Delayed hospital discharges cost the NHS about £285 million per year, and the evidence suggests that up to 14% of these delayed discharges can be reduced by accessible housing. Local authority money is available to make improvements to properties, but even still, Wellchild has over 700 families waiting for help. 90% come from social housing. Tara Parker, a paediatric nurse who also works with Wellchild, says their research shows Anderson's experience isn't that unusual.
Some young people will be delayed in an intensive care unit for approximately 12 months, and the cost of that is eye-watering. You could have bought and built them 3 houses by the time you'd done that. And while I recognise there's a shortage of housing stock, this is not an enormous amount of people. This is a very niche amount of young people, but still running into the thousands that live in the UK and are some of our most vulnerable.
Manchester City Council told us Bertie Schweeper and her son were rehoused by the City Council into their current bungalow property in 2019, which was subsequently adapted extensively. Occupational therapists searched for some months to find an appropriate home due to the size of the wheelchair in question. The supply of housing is a big issue. Just over 10% of people in the UK have a disability affecting their mobility, but just 9% of homes in England have key accessibility features, including level access to the entrance, a toilet at entrance level, and sufficiently wide corridors. It's not surprising then that the average waiting time for social housing tenants is over 2 years.
Where's your sock gone? You've only got one sock on.
Princess Belle is living in temporary accommodation in South London with her 13-year-old son, 11-year-old daughter and a baby. The eldest two children both have a rare genetic condition that means they are unable to walk or speak and have breathing problems.
So this is pretty much where all of their equipment is stored. And this isn't, I actually also rent a storage unit, which is a large garage size storage unit.
The four of them have been living in this 3-bedroom house for 8 months while they wait for their council to find them a new home. Every inch of each room is packed with clothes, toys and specialist equipment.
The odd times they have offered us properties in Kent, it's like, okay, well, this one's in Kent, it's where you wanted, but it doesn't have the space we need. You've offered us a 3-bedroom property. Where am I supposed to keep all of their stuff? They've got the children's occupational therapy report. It says that they need double rooms because they have large equipment, that they're growing children, their equipment's only going to get larger.
The difficulties faced by Princess and her children are shared by other families in the UK. New figures from the disabled children's charity Contact, shared exclusively with Newsnight, show that 41% say their home doesn't meet the child's needs, while 27% said they felt their home makes their child's condition worse or puts them at risk.
With the damp that's in the current property, it's been proven, and Lambeth themselves, from their own surveyor, deemed this property unsuitable nearly 8 months ago in January. We were told that we needed to be moved. For children like mine, it's a big deal, like a bit of mould. But for my children, it can be life-threatening because a pneumonia caused by the mould can then cause my daughter in intensive care, have to be on ventilators.
Amanda Batten runs the charity Contact that carried out the survey.
We were really taken back by the proportion of families who weren't only saying that the housing was unsuitable, but that their home environment was actually having a negative effect on their child's disability. I think there's no doubt that poor and inappropriate housing is having a hugely detrimental impact on the health and the lives of many disabled children and their families.
When we asked Lambeth Council about Princess's case, they told us this household has very complex housing medical needs, which we've been working hard to meet for some time, and we apologise for the delays in resolving this issue. However, we face a real shortage of available homes. Newsnight has been investigating the reasons behind the deaths of young people using evidence generated by the country's first ever national database of child deaths, which was published in May this year. Poor housing was identified as a contributing factor. In 2016, Molly Wells' son Harley was born with a brain injury and cerebral palsy. Molly, who lives in Ipswich, was only 17 at the time.
He needed round-the-clock care. He couldn't walk, talk, he couldn't sit up. He was fed via a peg tube, which would be in his stomach all the time. He needed all of his hygiene done. He couldn't do anything himself, as in nothing. He could lay on the floor and just kick around. That's all he could do by himself.
And did you have to do a lot of his care then for him?
I did all of his care. I did everything apart from when he went to school.
In 2017, Harley and Molly had to move after her private landlord gave her notice. The council found them a flat, but there was a problem.
What we can see here is these are the steps that lead to the property. When Molly moved into this property, they said that they would be able to put in a ramp to be able to, Harley in his wheelchair to go up these steps, but unfortunately that never happened. So what
Jackie Wood is a nurse working in Ipswich who has visited Molly at the property.
And as we go through the entrance here, we can see that this isn't really suitable for a wheelchair.
I had to carry Harley through the property. I had to lift him everywhere. I had to do ground lifts. I had to do everything because he had no equipment.
So you had a care plan, so that meant you couldn't follow the medical advice you were given about how to care for Harley?
Yeah, correct. I couldn't follow anything, physiotherapies, requests and stuff like that. I couldn't follow because I couldn't have the equipment which was needed in the property. He couldn't do physio, which possibly could have strengthened his legs, his back, his posture. He couldn't do any of that.
And what did you try to do to resolve your housing situation?
I got Harley's paediatrics doctor, physiotherapists. They wrote letters, supporting letters, to say that Harley needed, as a matter of urgency, he needed to be housed correctly. They said that they'd look into it, and it went on for 2.5 years.
In October 2019, Harley died unexpectedly. Jackie worked with Molly to support her and also carried out a review of his death, which fed into the National Child Mortality Report. What kind of role do you think housing played in the death of Harley?
The fact that, he had to be carried throughout that property, whereas in his care plan was for him to be in a wheelchair and to be hoisted, and the pressure that maybe that had on his body. Then I think it's really about asking that question, that does that then affect kind of life expectancy and mortality? What's just really sad, and when we did the review, the themes that kind of came up in Harley's reviews, actually we've gone on to see them in multiple other cases, so it really isn't an isolated incident.
He wasn't given a chance. I had to do the best I could for Harley in a rubbish situation, if that makes sense.
Ipswich Borough Council told us it provided the best accommodation we could for Harley Bow-Wells, but it was acknowledged by all that the property did not meet all of Harley's needs. We have a large shortfall of suitable adapted property to meet demand. We were building a specifically adapted bungalow for the family when, sadly, Harley died. The government has run a consultation on improving access to accessible housing, with a report due out in December. Campaigners say this is a vital opportunity to improve standards and potentially transform the lives of some of our most vulnerable children.
I think there is a window of opportunity now with the government's accessible housing review. Clearly, where we're building new houses, they need to be fit for the current and future needs of the population in the UK. But for our families that we work with at Contact, it really can't come soon enough. And fundamentally, the problem is that there is not enough social and affordable housing that is accessible to disabled children and their families.
Back in Manchester, the work in Anderson's garden is complete. It's now fully accessible and ready for him to enjoy.
It's amazing, what they have done. It's amazing. I just thank God for that. It's a new start, Yes, it's a new start. I'm so happy. Now it's a living place. Before, it was no way to get here. It's like kind of, our paradise. And this one, even Anderson is agree for that, It's happy for, yes.
Deb Cohen with that report. A government spokesman told Newsnight, "We recognise the importance of improving accessibility, and the number of accessible homes has nearly doubled in a decade. Since 2010, we have invested over £4 billion in the Disabled Facilities Grant, providing adaptations to almost 450,000 homes, including stair lifts, wet rooms and ramps. Councils are best placed to decide how much accessible housing is needed